This is Rachel Kelly, and I am here to share my discussion post for week 5, which is on gastritis or gastrointestinal bleeds. To first understand GI bleeds, you need to understand what we're talking about. So, a GI bleed includes any bleeding that happens from any part of the GI tract. So, that includes the esophagus through the anus, bottom to top. So this blight bleeding could have been caused by an ulcer due to too much acid coming from the stomach. It could come from a tumor or a polyp, hemorrhoid, inflammation of the lining, like in the case of diverticulitis or colitis, and for gastritis as well. Now this is more commonly to occur in men. It is responsible for acute gastritis and acute GI bleeds are responsible for 400,000 hospital admissions per year. So it is a common problem that you'll see in many patients working as a nurse. And it's the reason that this occurs is because of a condition. It's not a condition in itself. So when you're treating the bleeding, you're going to treat it as you would the result of another condition, as you do with every nursing diagnosis. Okay. So I have a slide that gives a good illustration of what I mean by ulcers and any GI bleed being the result of another condition, whether that be a medication treatment in the case of NSAIDs or a tumor formation related to cancer. So as a nurse caring for a GI bleed, so the first step will be in the nursing plan is to assess the patient for a gastric bleed. You will do so by monitoring the bowel movements of the patient. This will indicate where the GI bleed is occurring as well. If the GI is located in the upper part of the GI tract, if the GI bleed is located in the upper part of the GI tract, you'll find dark, tarry stool. And if it's in the lower region, you're going to see it as bright red. It makes sense. The blood is going to have dried as it goes through the system. You're going to monitor for blood in the vomit as well. And you're going to look also for coffee ground texture because that can be blood as well, just dried. Same as with the bowel movement. This is especially common if the patient's experiencing a stomach ulcer from vomiting. The blood is not always visible, so there's going to be other signs that you're going to look for that indicate a GI bleed. This includes subjective indications that the patient will share with you themselves upon assessment, including weakness, dizziness, abdominal pain. They're also going to have their vitals taken at that time, and you'll be able to assess them for tachycardia and hypotension, and your assessment will include the skin integumentary evaluation and an evaluation of their energy level. And all of these things are going to help you while you're trying to form your diagnosis of the patient. So, diagnosing your patient. In addition to your assessment, in addition to the data you collected in your assessment, you're going to have some tests that you have the ability to perform. The stool test is indeed a test where you will take a sample of the stool and have it sent down for the patient to a lab, and they will identify whether or not there is blood indeed in the stool. This is done by taking a specimen of the stool and you put it on it's a sheet that you place your specimen of the stool on, you dab it onto it, you then package it up, you fold it over, so the specimen is now enclosed in this envelope, then you package it up in a biohazard bag, double bag in a biohazard bag, per your protocol, per the hospital protocol where you are at. And this will help determine whether or not, what was the cause of the blood in the stool. It can determine the location using what is in what type of blood it is. So you're also going to have a blood test taken. That will be your basic blood metabolic panel. There are other tests as well, colonoscopy, endoscopy. These will all be pertaining more to the location of the bleed, though, and there were also x-rays and that will be performed likely. When caring for a patient who is experiencing a GI bleed, the lab work that will be ordered, you want to make sure that it's carried out. You're going to monitor its results, but that's going to be a part of the planning, is attaining and observing that lab work. You're also going to continually be taking vital signs for a patient experiencing or internal bleeding. Now, this is going to be to monitor for tachycardia and hypotension specifically. You're also going to want to determine the blood type of your patient. A patient experiencing internal bleeding will likely need blood transfusions or some intervention related to blood transfusions or replacement. Now you're going to want to evaluate your patient's current medication dosage plan, what they're taking regularly, and especially in the case of anticoagulants, because your patient is experiencing internal bleeding, so it's something that lessens its ability to heal, as something like a patient on a heparin treatment would be subject to, would be anti-therapeutic. You're going to want to perform a 12-lead EKG because blood levels affect cardiac output. Makes sense? Your heart is pumping blood. If there's less blood, it's going to affect your heart's ability to work, do its job. And you're going to continue to assess for bleeding in the stool, and if your patient is vomiting, that as well. Now, in order to implement these plan, you're going to need to do, once again, lab work. You're going to be checking that regularly. It's not going to be a one-time test. You're going to have strict eyes and nose. You're going to collect the stool. This patient's going to be having their bowel movements in a hat, and you will be monitoring each bowel movement before going in the stool. You're by now going to know the blood type of your patient, and there will likely, if it's necessary, be an intervention ordered by the physician to have blood replacement therapy. You will administer the blood as ordered and perform the vitals that are related to that as ordered. And then if your patient does indeed have a crisis of hypotension, there are interventions in place for you to take care of them, such as putting them in the Trendelenburg position, giving them fluids, and you're going to get the physician, as always, when something goes wrong or is abnormal. So fall precautions are going to be important with this patient. They are experiencing internal bleeding. Any injury or trauma could increase or exacerbate that. You are going to remember to check the vital signs. There are interventions for medication now that have been more recent in the past, improving the therapy for bleeding over the past few years, including Protonix. So this is a proton pump inhibitor. This is given through IV, and it decreases the amount of acid in the GI lining. This has been a very therapeutic and successful intervention medication-wise over the past decade. If it is not able to stop the bleeding, potentially surgical intervention will occur. It is noted that surgical intervention or interventions other than medication and time often occur during some of the tests. So if a patient's receiving an angiograph of their GI tract and they find a bleed, they are often able to give certain medications or interventions there on the spot. So you're going to evaluate as a nurse how your care for the patient who is experiencing a GI bleed has gone by continuing to evaluate for blood in the stool. You'll want to eventually see that there is no blood in the stool. That would be a successful evaluation. You're going to want to be no trauma to the patient, no injury, no falls, nothing that could increase bleeding. It is noted that often GI bleeds do resolve on their own, and if not, there are the surgical and medication interventions. You can always repeat the vital signs, and you're looking for normal vital signs. So if the vital signs are normal, within normal limits, not tachycardic or hypotensive, you can evaluate a successful intervention using that. Blood work will need to be continued to be repeated for as long as the GI bleed is ongoing. It's important to monitor the blood levels, especially specifically hemoglobin, and repeating an EKG throughout the blood work therapy will be important, especially if the blood levels were low. Now, thank you for listening. This was my research and my proposed discussion for GI bleeds, proposed care plan. Thank you very much.